Now, this next thing that I want to go to is not, it's kind of a reminder. This isn't necessarily a news story. This is from 2018, but this was sent to us today by Lady, one of our regulars who lives in Germany. Now, Lady uh, is a cancer survivor, and she's still amidst her struggle with that. And I believe she is from the United States, but she has been living in Germany for a long time. She entertains the idea of coming back, but she really can't come back because she really needs to stay on top of the care she needs as somebody battling cancer. I don't recall if she's officially in remission or not yet, but I do think she's still amidst her battle. And she's not on the stream today. She announced earlier, she tweeted this at me, and she said, I can't make the stream today, but I want to kind of remind everyone of this. And I think it's a real important reminder. So here it goes. This is not a happy topic by any means, but I think this is an important reminder. Almost half of new cancer patients lose their entire life savings. So this is from 2018, but nothing's really changed. According to a new study, well, it's not new anymore, but according to a study published in the American Journal of Medicine, 42% of new cancer patients lose their entire life savings in 2 years. It's because of treatment. The same study found that 62% of cancer patients are in debt because of their treatment. In the U.S., the total medical costs for cancer are $80 billion. $80 billion. 42%, they lose everything. You've saved your whole life. You've been wise, with your money, smart with your money. You've worked hard. Maybe you raised a family. And then you get sick. Which, who could that happen to? Any of us. That could happen to any of us. That could happen to one of us tomorrow. And it costs you everything because of this corrupt, predatory healthcare system that decided to make the human body a profit center. And it's so amazing to see headlines saying Medicare for all would be a disaster, and hearing that from people on the right and people who are supposedly on the left. We hear it from both political parties, Republicans and Democrats, talking about how Medicare for all is no, the system is a disaster. 45,000 people die per year because of lack of adequate healthcare coverage. They didn't have a life-threatening condition in most cases. They could have been helped, and they could still be alive today, but because of lack of healthcare coverage, they're dead. And the people that get help, they lose everything because of it. They lose everything. That's a crisis. That's a crisis. That's a disaster. That's a crisis. And it's a catastrophic crisis. And there's nothing pragmatic about an incremental solution to a catastrophic problem. So when people give you these half measures, when John Delaney gets up there telling us how we need these half measures, no, that's bullshit. We need an extensive, full solution that covers everybody, full stop. And we need assurance that nobody is going to go bankrupt because they get sick. And no, that's not a pipe dream. No, that's not a pony. No, that's not instant abs. That's something that every other industrialized nation in the world takes for granted. That is taken for granted in Canada and England and Ireland and Switzerland and Denmark and Sweden and France and Italy. It's taken for granted there. But we can't have it here. Somehow we can't do that here. And that happens to people every day. People get sick. And some people, they can't even get help. They're just screwed. They are literally, and this is no embellishment, they're literally left to die. That's literally what's happening. And then the people that can, they lose everything. A lot of them lose everything. That's really the health plan in the United States. Be rich enough that you can be prepared for anything. That's the best preventative health plan you can get in the United States. Be rich enough so that if something happens, you can handle it. Sounds foolproof to me. Sounds foolproof to me in a country where wages are about 30 years behind schedule. Sounds like a great plan. All right. So that's a friendly reminder from Lady, who I wish all the best to, and we'll see her on the stream again very soon, I'm sure. But she was not able to tune in today.
Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Yeah, yeah, yeah. You can tweet me an article at Ron Placone. We'll go through it together